Hello, my name is Angelina Williams. I'm going to be your student nurse today. Let's start off by you stating your name and date of birth for me. Patient states her name is Mary Traxler, born October 20th, 1999. Okay, Miss Traxler, so today I'm going to be giving you your physical assessment. Let me go ahead and close the curtain and provide appropriate lighting. Miss Traxler, do you know where you are right now? Patient states she's at East Central Hospital. Do you know what month it is? Patient states the month is October. Patient is alert and oriented. Are you able to go over there and walk to the restroom for me? Perfect. Patient's gout is steady and patient also has the ability to follow commands. Patient seems to have no signs of distress. Ms. Traxler, could you rank your pain from 0 to 10 for me? Patient states her pain is a 0. Okay, perfect. Patient seems to be well dressed for this appropriate setting. Patient is clean and hair is well kept. Patient seems to be in a good, calm, and cooperative mood. Okay, Ms. Traxler, the first thing I'm going to do is assess your toga above your sternum. Patient's toga is brisk and non-diminished. Next thing I'm going to do is listen to your heart sounds. I'm going to go down, notch, go over to your right second intercostal space, listening to your aortic valve. Gonna go over to the left second intercostal space and listen to your pulmonary valve. Gonna go down 1 and listen to your Erb's valve. Go down to the 4th and listen to your tricuspid valve. Then I'm gonna go down to the 5th intercostal space and listen to your mitral valve, and also take your apical pulse for 60 seconds. Perfect. Patient's apical pulse is 88. Heart sounds are strong and normal. Next thing I'm going to do is check your cap refill. Patient's cap refill is less than 3 seconds. I'm going to go ahead and check your pulses. Start at your carotid. I can't take both of them at once, so I'm going to go on this side first. Go to the second side. Perfect. Go to your brachial pulses on both arms. Go to your radial pulses. Then I'm going to go over and do your popliteal pulse on both legs. Then I'm going to go down here and do your posterior tibial pulse on both legs. Dorsal pulse. Great. Pulses are equal and strong bilaterally. Next thing I'm going to do is check and observe and auscultate your abdomen. Patient abdomen has no signs of any masses, bulges, distension, or any pulsation, so I'm going to go ahead and listen. I'm going to start at the right upper quadrant, left upper quadrant, and go down to your left lower quadrant, and right lower quadrant. Valve sounds are normal active in all 4 quadrants. Next thing I'm going to do is pulsate. Right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. There is no signs of any bulges present. Next thing I'm going to do is check your range of motion. So I'm going to start on this arm, do your shoulder, elbow, wrist, other side, shoulder, elbow, wrist. Let me go down to your legs and do the same exact thing. Hip, knee, ankle, hip, knee, ankle. Perfect. Patient's range of motion is equal and bilateral in the upper and lower extremities. I'm gonna go ahead and check your muscle strength. So when I push up, you're gonna push down, and when I push down, you're gonna push up. Down, up, down, up. Do the same thing with your hands. Down, up, down, up. Do this arm the same exact way. Up, down, up. Hands as well. Up, down, up. Perfect. Could you squeeze my hands for me? Perfect. Thank you. I'm going to do the same thing on your lower legs. Down, up, down. Same thing with your feet. Down, up. Other leg. Down, up, down, up. Feet. Up, down, up. Great. Patient muscle strength is strong and equal bilaterally in the upper and lower extremities. Also, while doing these exercises, I noticed that there are no signs of ecchymosis, arrhythmias, abrasions, or any wounds on the anterior side of the patient's body. So next thing I'm going to do is I'm going to listen to your heart sounds. Lung sounds, I mean. Listen to your lung sounds, Ms. Traxler, I'm sorry. Only thing I need for you to do is breathe in and out for me. In, out. Deep breath in, out. Deep breath in, out. In, out. Go over here. In, out. Perfect. Go on this side. In, out. I'm just gonna have to lift you up really quick. In, out. In, out. Go down. In, out. Go over. In, out. In, out. In, out. Okay, perfect. Patient's lung sounds are clear on the anterior, posterior, lateral, and bilateral. Also, while I have the patient sitting up, I'm going to observe, and I notice that there are no signs of ecchymosis, arrhythmias, abrasions, or wounds on the posterior side as well. Patient's skin appears to be warm and dry, and the patient's skin color is even and appropriate for patient's race. While I have the patient sitting up, I'm going to go ahead and check for her pupils so her eyes can be open. And I'm going to dim the lights first. Patient's pupils are equal and reactive. Okay, Ms. Traxler, now I'm going to check your sensory functions. So this is going to be sharp, and this is going to be dull. So basically, you're gonna say what you feel. So let's get started. Sharp, dull. Do the same thing with your legs. Sharp, sharp. Patient's sensory functions are intact to all of her extremities. Okay, Ms. Traxler, so now I'm going to go down here and observe your legs and make sure there's no swelling or edema. Just going to poke. There's no edema present. So, Ms. Traxler, I believe this concludes our physical assessment. Is there any questions you would like to ask me before I head out? Okay, great. Your call bell is right here in reach, just in case you need it. I'm lowering your bed and raising your side rails. I'm going to go do me some hand hygiene, and then I'm going to go ahead and document your stuff that we found today. Have a good day.